Now, a lot of times I think we are unfairly criticized because they say, well, you just are against things. No, I'm just against bad things. And we actually have a lot of good ideas. There's a lot of great things we can do to reform the healthcare system with the free market. And here to talk more about that is my good friend from the John Locke Foundation, Dr. Michael Sanera.
Thank you, Dallas. Happy to be here. What a great crowd. President Obama wants you and the rest of America to believe that it's either his plan or no plan. He said that over and over again. But what I'm here to do is talk about some very innovative ideas on how to fix what's broken in the healthcare system and not throw out the baby with the bathwater and give a one-size-fits-all government program as the solution. Now, another thing is that they often say that it's the private market that's failed here, so government has to get in and fix it. Well, it's the other way around. What we live with is government health care almost across the board. 80 to 90% of the current system is government run, with only about 10% is on the free market. So our proposal is, let's fix it by moving more and more towards free market, which means that you would have more choices, that costs would really come down rather than through rationing, and that way we would move toward a much better healthcare system and solve some of the problems. Now, first of all, many of these changes that I'm recommending are even at the state level. They can be done by the state rather than the federal government. The first is mandates. Each medical group has lobbied the legislature to get a mandate to force you to buy insurance that includes coverage that you may not need. That obviously drives up the cost. Now, some of these mandates, I know I need one of these mandates, which is the hair transplant mandate. And so I want to force you all to buy that insurance so that I can get it. But there's other ones such as chiropractors, acupuncture, dental, and so forth. So each group has lobbied the legislature to get that in there to force all of you to pay for that. Now, obviously, some of those are needed by various individuals, myself included. But why shouldn't I be able to buy a policy that just gives me the things I want rather than being forced to buy the things I don't want? That's the critical in bringing down healthcare costs. Now, another thing is when you go, many of you go on Amazon.com, you can buy all kinds of things, houseware, books, music, etc. on Amazon.com, and that goes across state lines. But the one thing you can't buy on Amazon is healthcare insurance, because it's a state law to prevent you from doing that. And so we need to repeal that state law and open up more choices. That one thing would drive the cost down because there would be more competition. In addition, we have what are called certificates of need. Certificates of need. We're one of the very few states that rations healthcare by controlling the number of hospital beds, the number of MRI machines that can be utilized in the state. And this limits supply, which limits your choices and keeps the cost artificially high. And how does this system work? Well, they set up a political body in Raleigh, and then if your hospital or a new hospital wants to move into the area, they have to apply to this political committee. And the political committee is controlled by the big hospitals. Do the big hospitals want more competition for more beds and more hospitals? No, so they turn them down. We have the ludicrous concept in Wake County where only 44 hospital beds can be built per year, and they fight over where they're going to be, and the big hospitals usually get those rather than some other hospitals. We also have tort reform. Doctors are paying hundreds of thousands of dollars in insurance payments to protect themselves against lawsuits, and that is one of the things that again will drive costs down and give you more choices. Now, 2 points. number one, Kay Hagan, when she was in the legislature, could have passed these reforms. Did she do it? No. Okay, no. Are these reforms included in the Obama national plan? No. Okay, tort reform in particular, probably a few of you know why. The trial lawyers. The trial lawyers have bought and own the Obama administration, and they're not going to have any reform that will cut off their bread and butter in these lawsuits. Now, we urge you to contact your Congressman and Senator Hagan, and when you do, I have 5 questions that you should ask them. Okay, 5 questions you should ask them. Number 1, Congressman or Senator, can you promise that I will not lose my current plan or doctrine? Okay, Barney Frank and Paul Kluckman have both said that you will. And so these are very important people in the process. Number 2, Congressman and Senator, can you promise me that Obamacare will not lead to higher deficits in the long term? Well, their own Congressional Budget Office says that it will. It will increase deficits as far as the eye can see and does nothing to bring down costs. Number 3, Congressman or Senator, can you promise that the government bureaucrats will not ration health care? Okay? That's the only way they can keep costs down, and so they will definitely ration health care by the same way that Canada and Britain and other places do, denying coverage and making sick people wait in long waiting lines to get treatment. Number 4, Congressman or Senator, can you promise me that my tax dollars will not fund abortions? Well, there are several versions of this, and some say that it's in the plan, others say that it will be left to the Secretary of Health and Human Services to make that decision. Now, you can imagine how that decision is going to go, can't you? And number 5, and probably most importantly, make sure you ask this question. If you don't remember the other ones, ask this one question. Congressman or Senator, can you promise me that you, your family, and all of your staff will enroll in the public plan? Okay, that's the critical question. If it's good enough for us, it's good enough for them. They have gotten away with passing laws that exempt them from those laws far too long. Now, there have been amendments offered to require that, and guess what happened? They're voted down. Guess who has the majority to vote them down? Okay, now why do they vote that down? Because they have a wonderful plan. A new congressman or senator goes in and they do fill out their paperwork for their payroll and get their office. One of the things they do is sign up for the congressional health care system. And guess what? How many choices do they have of different plans that they can be covered under as a congressman or senator? 283. 283 plans that they can pick from. Okay? They have to have help trying to figure out, which one's the best for their particular circumstances. If 283 choices are good enough for them, 283 choices are good enough for you and me and everybody else. We need to free up the healthcare system. We need to make it more market-driven. We need to give you more freedom, and we need to give you more choices. Thank you very much. I'm from the John Locke Foundation.
Thank you, Dr. Samara.